the opioid crisis.
Yes.
Where are we? What are you doing? I know there's a bill that's moved in the House, it's
Yes.
passed in the House and the Senate. Some of our friends over at St. Joseph's
Wow.
Medical Center, they're very involved in this.
They
in terms of
caught
ED.
me. Yeah.
They're trying to cut out the overuse and abuse of opioids in the ED, other hospitals as well. Go ahead.
Well, they're doing two things. One is trying to lower the prescribing of these opioids when you really don't need them. And number two is they're seeing when you do overdoses, people come to the hospital, they often leave and they'll overdose again. But they found a way to dramatically cut that down, a model for New Jersey. And their data can't be argued with. So I looked at that and said, this is something that actually works. It's an evidence-based solution to this national crisis, epidemic-like proportions. The death rates are out of control in our state and others.
What can the federal government do, Senator Booker?
Number one, we could fund programs like this that are evidence-based. Investments actually save money for taxpayers long range, because if you invest in stopping repeated overdose, you're stopping the cost of these addictions. And so we need to fund these programs, and I'm so happy that my bill, this ALTO bill, this
alternatives to opioids.
Towards opioids, is now part of that legislation as well and moving through Congress. So we need to fund more money to programs that work, and we need to find the best practices around our country and attack this problem. If this was a foreign attack that took this many lives, we saw what happened after 9/11, 3,000 lives. Literally, we've spent hundreds of billions of dollars as a result of that. This is tens and tens of thousands of lives, but we're not treating it like the crisis that it is.